I do have a couple of pre-questions for everyone to kind of mull over as we go through the presentation. And feel free to think about how they relate to you and the information that we'll be talking about. So one of the first questions that I have is, we've obviously created this for several different types of audiences. And my question to you would be, have you worked with any of these audience types that we're going to discuss? And if so, have those materials that we're discussing worked? What types of conversations and materials have worked? And any challenges or successes? So really just what works with the audiences that you've been working with. And then regarding the tools and resources that we're going to discuss, have you used any of the youth health transition resources that have been created? Have you gone to our website? Have you used the materials? Have they been helpful? And then on top of that, maybe anything that you've created. So I know that's a lot of different questions, but they're kind of really focused around the audience types and the tools and resources that you have available or have used. And so those are just kind of where we're going to go with some of the conversations as we continue forward with today's presentation. So with that, I'm going to jump in as much as I can jump in with coordinating all of this stuff. And let's see. Oh, there we go. It advances. All right, so to help me with some of the presentation and just to keep us on task and on target, here are some of the learner objectives that we would hope that you would walk away with today. And they'll be part of a survey that Lynn will provide in the chat box for follow-up after today's learning community. So really, first defining what youth healthcare transition is, including what it is and why it's important. Then we're going to describe the healthcare provider role and how you can encourage successful transitions. I'm also going to talk about 3 Youth Health Transition Initiative created presentations and how they are for distinct audiences. Oh, you guys can see all of my questions there. All right. So then the next thing would be where to access the resources provided by the Youth Health Transition Initiative. And the great thing about Zoom and the conferencing platform and the sharing of screens is that we can actually, if people would prefer, walk through the website together if you would have any questions about where you would find those materials. All right. So, navigating multiple screens. I just want to start off with a quick who we are. And why I do this is because hopefully, as we continue to spread the word and have a lot of people joining us, there might be people that have not heard of our group or are kind of wondering what we do and why we do it. So I want to just start with who we are. We are a statewide initiative. We are called the Wisconsin Youth Health Transition Initiative. And we support the youth to adult healthcare transition process. So really the purpose is to make sure that there are tools, there are resources, and they're all developmentally appropriate education and awareness to support people as they move from pediatric world to adult healthcare in an uninterrupted manner. And that process typically starts in early adolescence. We encourage it a lot younger, but with things happening as they are, we can only start at a certain point. And then with the formal part of the transition, the actual active transfer of care taking place between the ages of 18 to 22. And really that depends on the individual, what makes sense and what's appropriate. But these are some general guidelines on the ages that we would expect that to take place. Some of the efforts that we do are I've broken them off into 4 separate areas. One is just to provide support to healthcare providers and organizations. The second is to facilitate the learning community of which everyone here is participating in. We hold these quarterly, and our next one will be in November, and I'll have information about that. But today we're talking about some of the tools and resources that we have available. And one of those resources that we'll be talking about is the Health Transitions website, as well as some of our community outreach tools and resources that we provide, as well as how we disseminate those and who to for resources and tools throughout Wisconsin. So who's here? I don't know if I want to go through and have everyone unmute their lines and do the whole introduction thing, because I kind of feel like that cuts into our discussion time. If anyone is strongly opposed to that and would really like to go through and introduce everyone, send it up into the chat box and I'll know that. But I was kind of thinking everyone could test out that chat feature and kind of just type in who you are, maybe your profession if you don't want to include name, just an idea of who's joining us today. Are you a regional center support staff, a regional center director? Where are you coming from? Are you from Wisconsin? I would kind of hope, because this is all kind of Wisconsin based. But that's what we'll use that chat feature for. And it will really, as we go through the presentation, will help guide some of our discussion points if anyone would need that information. So I'm going to start in with some of these objectives that we talked about, which is, what is healthcare transition? And the formal definition is a purposeful planned movement of adolescents and young adults from a pediatric environment to an adult-oriented health system. And really what we're talking about is making tools and resources and support available so as that a child gets older and becomes an adult, they are able to make that transition from the more cocooned, supported pediatric environment to taking care of their own healthcare needs in an adult healthcare setting. So we recognize that transition is a process and it includes a lot of different things, but the area that we're going to be focusing on today is health. So who needs to think about coordination of care and the healthcare transition process? And really that includes families and teens of anyone who will be turning 18. And it typically is not as dramatic for those that don't have a special healthcare need, but it is incredibly important for those who identify with a disability or special healthcare need, where that transition from healthcare in a pediatric environment where a lot of things are being monitored and taken care of now suddenly becomes the responsibility of the adolescent, who needs to then be able to coordinate some of that information on their own to be able to independently take care of themselves and their healthcare condition or disability as an adult. So why is health so important? Well, if you don't have your health, you can't be out in the community supporting people, doing work, and being a productive member of society. So really, by having your health and knowing how to take care of yourself, you are increasing your independence. It's allowing for success and even just daily living skills, allowing you to continue your education if you would so choose, and then to continue working or taking on some sort of vocational designation later on in life. So really what we're trying to make sure of here is that everyone knows how to take care of themselves, what is appropriate for mental health, what is appropriate for if you end up getting sick, who do you go see? So a lot of these questions maybe don't even have specifically to do with a chronic or complex medical condition, but rather just the day in and day out of making sure that you are healthy, and if you're not, knowing what to do and where to go for that sort of support. So one of the things that we really encourage throughout the transition process is healthcare transition planning, starting early, talking about this often, and making sure that there are plans in place so that as you get older, not all of this information needs to be addressed all at once. Unfortunately, a lot of times with a disability, special healthcare need, or chronic condition, they're managing the fires of today. The things that need to be taken care of that day only. And typically there's not a lot of time left for thinking about the future. So we try to, with the tools and resources that we offer here, not only provide systems and providers and clinics with information that they can use, but also tools and resources for families and adolescents as they are beginning to think about the transition process. Even just simple questions such as, who do I see if I'm sick? Or how do I get a prescription filled? Some of these questions are just quick things that you can start doing to make sure that you're ready to transition. So some of the categories that we talk about when we talk about health are, and we have physicians consider, we have clinics consider, we have youth and families consider, are the self-disclosure. Who is it appropriate to tell about any chronic conditions or special needs that you have? And when is it appropriate to disclose them? It might be appropriate to let an employer know about a special healthcare need, but it may not be appropriate for you to tell the person at the grocery store. So kind of knowing when to disclose and talking to a child younger about when it's appropriate and when it isn't. Some of the daily living skills involved with things just like if you have a headache or a stomach ache, or how to identify when you don't feel good versus when you are lively and feeling great, and even things like mental health as well. Accommodations, how you can appropriately ask for those sorts of things, your rights and responsibilities, and then of course employment. So when we talk to healthcare providers and we talk to healthcare professionals and the community partners, these are the main areas that we say are important to make sure that individuals are aware of or have started thinking about. Then we get into kind of the, not laundry list, but the longer list of things that are appropriate to continue considering as you move towards a more in-depth look at how you're going to take care of your health in the future. So for some, that includes decision-making. Will they be needing help to make decisions, or will there be somebody that will be put in charge of making decisions as they get older? How they manage their health, time management. Who will their healthcare providers be? Unfortunately, some physicians that we've grown accustomed to in the pediatric world are no longer able to take care of us in the adult world. So whether or not that transition is going to have to take place to a new doctor is a huge part of the transition process, and something that we'll talk about in some of our presentation highlights in a little bit. And then healthcare coverage. How are they going to continue receiving coverage after they turn 18? Are they able to stay on their parents' plans, or will they need to get their own? Are they using private insurance or public benefits? These are all questions that we make sure are things that are also considered during the transition process. So I put this in here as a recommended timeline. Again, this is from the National Alliance to Advance Adolescent Health. These are the suggested ages of certain activities that should take place in the transition process. However, we do like to say this should also be based off of what is and will be developmentally appropriate for the individual. But this gives us a time frame to just kind of keep in mind as we move forward. So really, then we get into the roles and responsibilities of the healthcare professionals, the community supports, the organizations that are involved in transition, and our responsibilities, and what that looks like when you're also trying to interact with the patient and the family. So that's a huge kind of thing that all goes into really what we've gone on to describe as care coordination. And there is a formal definition, and there are obviously designated people that act as formal care coordinators inside of a healthcare system. But typically when we're talking with families and youth as well, and quite honestly providers, sometimes this role is not a formal designation that's paid for. It's supported inside of a healthcare system, but rather it's something that somebody's taken on because it needs to get done. So facilitating the linking of resources to children and families as they begin that process of transitioning is a huge part of what makes the healthcare transition process possible. So we talk about care coordination in a formal setting, but we also acknowledge that there are a lot of people who are acting as amazing coordinators of care who do not have this formal designation. So how we get started, typically when we're giving these types of presentations, we want to break it out into those three areas, especially when we're talking to clinics, healthcare providers, and families. There is some roles and responsibilities of each individual who's involved in this process. For the youth, we really encourage them to talk. Start asking questions. Why are we doing this? Why do I need to take this medication? And if possible, giving them a chance to try talking with the doctor, you know, saying how they've been feeling for the last year or so, and allowing them to take more of an active role in their visits and some of identifying things that are important to them. And then for parents, again, talking, but maybe not as much as the youth, explaining to your child or adolescent why you're doing something. Why do we go in for annual visits? Why are you getting this shot? These are all important information for them to have. And then trying to limit the involvement where possible. And then we encourage those healthcare professionals to ask questions, explain, much like the parents, or instead of the parents. Sometimes that makes more sense to hear it from them, because sometimes teens don't want to listen to your mom and dad. They are they're not the experts. So this is just a way for health professionals to be more involved in the process, and then to gradually increase the amount of time that they are alone with individuals, and making that possible. So really the role we're asking for from providers in that healthcare transition process is making those meaningful conversations count. So asking and answering questions, listening and understanding what a youth and a family's needs and concerns are, and using a framework to identify youth abilities and strengths. Something that we'll point out in the near future is a shared plan of care. And this is a great tool that can be used inside of a healthcare setting, in a clinic setting, between the doctor and the family and the youth, as they start to identify areas where the youth would like to start to take more responsibility, and some of the things that you can do to work towards that. And that leads to this coordinated and collaborated approach to person-centered shared plans of care, and the guidance of access to resources based on what that youth has identified as important. So really, the healthcare provider role is to provide that support to a family member and the youth as they start to make this transition from being cared for to being independently in charge of their care. And those optimal outcomes include having a collaborative provider, engaged families, and empowered youth, and really to enhance that quality of life going forward. Now, realistically, are all of these three things involved in that warm handshake when we transfer from being in pediatric world to adult healthcare? It's the ideal, but it's not typically all happening at once. So it's really making sure that some of these things are just kept in mind as we move bit by bit towards making improvements in the way in which we provide support and have access to things for individuals as they make that transition. So now getting into the meat of what I wanted to talk about today is the support that the Youth Health Transition, or YETI, can offer as we talk about the healthcare transition process. We have tools and resources, which I'm going to go through. But first of all, whenever I am giving a presentation, whenever I'm talking with individuals, my first question is, who am I talking to? Am I talking to families and parents of the individual who will be making that transition? Am I talking to a community or a professional support person who would be there to help the family, but maybe not the final decision maker? Am I talking to providers and staff in a clinic setting or at a system level? Or am I actually talking to the adolescent themselves and how to encourage that independence? So really, before any of these tools and resources can be used, we have them sectioned off based on the audience that you'd be talking to. So this really needs to be that first question, is who am I talking to? With that in mind, then you can look at some of the tools and resources that we have available on our website. I'm going to go through them in list format, but again, if anyone would want to see them on the website, we can walk through that. We have a readiness assessment. The readiness assessment is a tool, and I'll just list them. Here we go. Readiness assessment, the 8 tools of transition. We have healthcare professional resources, and then presentations with a variety of audiences in mind. So let's jump into that first one, the readiness assessment. This is a one-page list of things that Got Transition, our national partners, has designated as questions that an individual, the adolescent themselves, or and the family member should be thinking about when they're thinking about how ready this individual is to transition. So there is a youth version of this, and there's a parent version of this, and oftentimes in our presentation, we'll have, especially when we're talking with youth and families, we'll have the youth take the answer the questions, and the parents answer the questions, and then compare the results, because it's a really great activity to really spark those conversations. The other thing that's just recently come up, and this would be again a resource, but a newer resource, is if you go onto the Got Transition website under the, I believe it's the Youth and Family tab, there's a electronic version now of the readiness assessment, and you can go through and take that online with the results coming up at the end, and then additional resources that are suggested for your use afterwards. If anyone, we can walk through that, but I think let's start with more of the resources. Again, let me know if you want to see that. I can make it happen. We also have our 8 tools, health tools. And these are the tools that we as the Youth Health Transition Initiative have felt are very important towards making a transition from pediatric to adult healthcare. You can find this information and all of the workbooks and additional resources on our website. And you find that by, let's see if I can actually just bring up the website. I keep talking about the website and I'm not showing it to you. Here it is, the website. So you can find this information under the Youth and Families tab. And when you go under the Youth and Families tab, you'll notice here's the Youth Readiness Assessment Checklist. And when you click on that, it should pop open. All right, there we go, for youth. And there's a similar one for parents as well. And then we have condition-specific tools, and these are things that Got Transition has gone through with the national accredited organizations for certain diseases or condition-specific organizations, and said these are what this child would need to help transition. So I would encourage you to go to this part of the website and look at that information. And then I mentioned the 8 tools. So if you scroll all the way down to the bottom in this step-by-step area, you'll notice that we have additional resources and the Build Your Bridge workbook. And this is the full workbook that we provide in our Build Your Bridge setting. But we do offer it also on an electronic format. It doesn't have the ability to type it in forms yet online, but you do have the ability to access and print that off along with our My Health Pocket Guide. So those are where you can find some of the family resources. Here I've just listed out all of the tools that we talk about. We talk about adult providers. Again, that conversation of will you be able to stay with the provider that you've had, or will you need to be transferring to a different individual? Decision making, we talk about health insurance, emergency contacts, appointments, medications, a medical summary, and a section that we've called About Me, but that's really where the adolescent can start to talk about the things that are important to them, goals that they might have, and it's just an area to kind of say who they are and what they like. And we found this to be helpful in a variety of settings. These tools can help with healthcare management, employment, independent living. I'm going to come back to high schools and post-secondary, the completion of a continuity of care document, and then self-advocacy. And the reason I wanted to come back to the high school and post-secondary settings is because one of the additional things that we found is very important is for collaboration with healthcare transition inside of the education or the school setting. Because many times youth and teens are spending their days in schools. And typically those with special healthcare needs are seeing school nurses or are in a special education setting, or are seeing their teachers on a daily basis, and needing to know how to manage their healthcare inside of education is incredibly important. And so we've coordinated our information and aligned it with what is now required is that post-secondary transition plan, or what they call the PTP. So we've gone through and aligned our materials to fit with that information. And we'll go through that a little bit more in one of the presentations later. But really what it does is it walks through for teachers and school nurses and anyone who would be in that education setting, how to align our tools with the PTP, specific questions that would be asked on the PTP and how our tools relate to that. So that's a great presentation. We don't offer that as something that our regional centers can give, but we are happy to come out as the transition hub and give that presentation. And we'll talk about that in a little bit. One of the additional things that we offer, and this is not a tool that we provide in a family or a youth setting or for our community partners, but this is a provider resource that was created by the healthcare group at Texas Children's Hospital. And this is one of their doctors there, Dr. Albert C. Hergenroder. And they've created this book that is called Building a Program for Adolescents and Young Adults with Chronic Illness and Disability. And this is a great tool for how to actually implement things inside of a inside of a clinic setting. So this is more for those provider education series where we are talking with providers, clinics, healthcare systems about how you can implement things inside of your system versus when you're in the clinic setting talking to mom, dad, grandparent, and youth in that sort of clinic setting. We're talking about how to implement it at a healthcare setting. So really this is a tried and true, great ways and resources to use. It's a rather thick book, but it's got some really great ideas and some things for us to consider if we be doing that. One of the additional things that we also talk about when we're talking to providers is this idea of quality improvement. So these are the 3 questions that we typically offer to clinics that are looking to do quality improvement work inside of youth health transition. Is what are you currently doing? Or is there a way that you could improve something that you're currently working on? And where are you finding challenges or gaps or barriers in the things that you're working on? And are there opportunities? And then we ask for one accountable action that the group could take moving forward. So really this is again an area where we've broken off from the things that we're doing, and I just looked at my questions, so I just threw myself, and we ask these questions of the group and we allow for some time and some discussion, because really our role is to give this information out and then to let them work inside of their healthcare system and with the knowledge that they have to say what's going to work for them and what isn't. We do eventually get back to some implementation recommendations, because always there's, these great ideas, but there's just getting people started to think about them. And so we do that through some recommendations where, okay, if you really can't think of anything, here are maybe some suggestions on ways in which you could do this inside of your clinic. And this is part of our provider education and awareness building presentations format. So now these long-awaited presentations that I keep referring to. And again, as you can tell, I'm getting to the tail end of the presentation here. So are there any Again, feel free to jump in if you have questions. Feel free to put them in the chat. I can see Lynn's doing that. She said, have you seen this readiness assessment? Yeah, so feel free to answer, people. I'd like to know what you'd like to see. I'm going to continue in with the presentations, but ask your questions. Let me know. Is this working for you guys? Are you finding that these are the audiences that you're working with? Are you running into challenges with these audiences? Is there anything that we could maybe talk about as a group to help problem solve through a particular challenge? I don't want to give away all the questions that could be asked, but feel free to ask some questions. Here are the 3 presentations that we do offer currently. It's the Build Your Bridge, which is that workshop. It's 90 minutes. It's for parents or adult allies or supports of the individual who would be making that transition. Youth are welcome to attend, but it typically is for parents thinking about how to start involving your child in the transition process. And then Bridging the Gap is our presentation that we can do that's a little bit more tailored specifically to the audience, depending on who the audience may be. And we'll get into the breakout of those different types of sessions. But this is typically for like a conference setting, 45 to 60 minutes, typically with discussion at the end. And then we have our provider education series, which is a modular presentation of what is now 6 different modules focused for the healthcare professional and clinic setting, really with the goal of focusing on helping them to develop the way in which they do healthcare transition inside of their clinic workflow. So this is very clinic specific. It's very focused on that individual clinic and requires a little bit more work as a team to put together and complete the modules. So we do vary the presentations of that Bridging the Gap. And we do have some core content that's common across all of the presentations, but we do offer 2 main handouts that come with every presentation, and that is the 8 tools on transition, typically offered in a 1-page setting because we don't want to provide the workbook without any guidance. Really, the idea behind the workbook is that people walk through it together and have a chance to fill it out. So this 1-pager is kind of like the Cliff's Notes to here's what you're going to talk about if you would do that workshop. And then the readiness assessments, the youth and parent one, again, a way for us to just spark conversation, or if you're not going to take anything away from the presentation other than this piece of paper, here are some areas that you could be thinking about. So again, this gets back to the variations are really based off of who our audience is. Who are we focusing this presentation for? For parents and families, typically that information is going to be very focused on what you can do for your child. For educators, it's more of a, how can I support a parent and a child as they would be looking at this information? Because typically, educators are one of the people that second to parents see the child most throughout the day. And for those with chronic and complex medical conditions or disabilities or special health care needs, the school nurse may also be part of that. And typically when I've gone to these educational seminars, what I hear is, I want to be involved in the IEP, but I don't know how. And I don't know what I could offer that would be helpful. So really this is where we started using that PTP and some of the questions that are asked on that. And we said, here are the questions that they're asking. Here's how they relate to health. And here are some of the things that maybe you could bring up at the IEP or would be appropriate to maybe kind of explore with parents, and not just leaving them hanging, but then offering those resources that we have in addition to that readiness assessment, that pocket guide, the workbook, lots of different things that they can then say, and here I can give this to you to help. Because saying, yeah, I understand, I know that's a problem, what are we going to do about it? Well, here we have some resources that we can actually hand to the parent, hand to the youth, and say, let's think about these together. And then we talk about communities and professionals, and I kind of went into some of those resources as well. So then we talk about conditions and disabilities and other foci. So one of the things that we do with these is sometimes we're asked to come and give a very specific presentation, for example, to a group of individuals who have diabetes, or to a group of individuals who have been diagnosed with intellectual or developmental disability. So we want to make sure that what we're giving them is age appropriate, condition appropriate, and really focuses on their strengths and what would be appropriate for their age and stage of transition. And then where is this going to be used? That's the final question that we ask, is kind of this: in what setting are you going to be applying these tools? Are you going to be using them at home? Are you going to be only talking about them when you go into the clinic? Is this specifically just a list of numbers, names, and things, and that person, you know that they're really a follow-through person and they're going to go out and call these numbers and research these things and go through them? Or does it make more sense to walk through some stuff so that it really gives them a chance to practice and take accountability for some of the things that we're asking them to do? So those are the things that we do when we talk about the variations. I see a question from Lauren. Says, I don't have a question. Okay, so it's not a question. But see an opportunity to bring transition work to the clinics at the hospital. What do you mean by that? Sorry, we'll
Lauren,
come back.
Yeah, I was going to say, this is Ann. Maybe we can talk a little bit more about that as we go through this.
Sure. So I have I've got maybe like 4 more slides to go,
Yep.
and then we can go from there. So here's the next one. So then, with the idea that we're talking about specific audiences, there are different types of handouts that we would provide based off of what we're going to be talking about. In a clinic or a workflow setting, or oftentimes when we're talking about our quality improvement work, we talk about a shared plan of care because we partner with our medical home group to do the quality improvement grants. And I do need to remember to mention that. So Colleen, hold me accountable for that at the end of this presentation. We also, when we're typically talking to providers, we have an annotated list of web links, or we offer hard copy templates in situations like when we're talking to educators or school nurses, or we're asking them to apply our tools inside of a different setting. This is when we offer things like alignment with the PTP, questions you could ask in an IEP. I'm getting into the alphabet here. Things that a school nurse maybe would want to consider for the IHP. And then in those situations, we also find it's useful to offer case studies. The current presentations that we have from that Bridging the Gap, and I'm gonna quick give everyone whiplash as I jump back. So I'm talking specifically about this one right here, the Bridging the Gap. We offer it in several different versions, audience specific. There's an education one where we talk specifically at an education level, so applying with the PTP. We've created one that's a little bit more specific to the school nurses, those that have an RN or a nursing degree and are working inside of a school. So have that healthcare professional / education overlay, and offering them more focused resources that would be specific to a nurse. And then we offer community partners and organizations that may be offering referrals or tools and supports, or even just connecting families and youth with the resources that we have. And then parents and families, and information, as I said, through that Build Your Bridge that would be useful as they start to bring their child into the transition process. My last slides here were just our link to our national organization's website, as well as the Health Transition website. We have about 15 minutes left. One additional thing that I wanted to point out, and I think this will kind of get us back to that question about how this can apply in a healthcare setting is the clinics and healthcare systems that we have right here. Under that, we have for the healthcare provider. And if you click on that, eventually the healthcare provider website shows up, and we have all kinds of information that's available to the healthcare provider, including our upcoming Baylor event, which you can go to the training and events section and expand that accordion, and feel free to register for Baylor that's happening in October. We also have information with our national partners, the Got Transitions core links to providers and their resources. But the one thing that I really wanted to point out is as we do these provider education modules, we do offer, as I said, that annotated list of resources. So we talk about, and I know I don't want to get everyone dizzy here, we talk about the different areas in which and how we do education inside of the clinic setting. Typically, we start with an overview, and we find that many clinics just appreciate that baseline. Here's what you need to know, the basics, the foundation as we're going into transition. And then we get a little bit more advanced, and the idea is that you move these modules forward and increase the amount of work that you're doing in each one of those areas as you make your way through the modules. And then this is our provider supplemental. When we do provider educations, typically we provide these in a printed out version, but we've had many times where people are joining us electronically. And so it's great to have these available on our website where we can just guide them here and say, hey, if you want to look at these things after we're done with the presentation, feel free to go to our website and here's all of the information. We leave them a little bit hidden because the idea is that this is really for, this is for a clinic workflow in a clinic setting. It's not meant to be used by parents or by youth as they're thinking about transition, but rather how a healthcare transition group would, how a healthcare clinic would implement healthcare transition inside of their clinic workflow. So with that in mind, Lauren, can I have you just explain what you mean by your question or your comment?
I was just thinking about that I don't have my partner in crime, or the one who knows everything, Kara, here to ask her, but and I know some work has been done in the ambulatory arena on transition, but I think that there's certainly opportunity there to do more of that work.
Okay. And how about from others, with that in mind, from what Lauren said, anything that sparks interest or comment or something you've been doing? Nope. Okay, well then I'm going to keep going. We also then tend to find some, well, I guess, Lauren, I think that's a great idea. And I think I would love to hear your thoughts on areas where you think something like that would work. So if you want to leave them in like a parking lot in the chat box here, that's great, or email me afterwards. Or if anyone on the call has been doing that kind of work and just doesn't feel like they really want to try to articulate it in this setting, please feel free to email me afterwards. We're always looking for additional ways in which we can be spreading awareness and spreading education around this. Yes, yes, please share. Look to the chat box, everyone. One of the additional things that we also offer is journal articles. And these go, they start at 20, there's additional ones, and apparently I didn't hit the save and publish page, so those will be available once I can log out, log back in, and get it all published. But these are journal articles that have been published around healthcare transition. So just a last little bit of a look at our website, since we have about 10 minutes remaining, is the training and events that we have, as well as some of the opportunities that we have for healthcare professionals and clinic settings. So we'll kind of go through that in the last 10 minutes here, unless anyone else would like to add something. And you can let me know that you're wanting to talk by hitting us up in the chat box. So we offer this Baylor College of Medicine's transition from pediatric to adult-based care, and they offer it in a broadcast. And because we are part of the Wisconsin LEND program, we have been offered the opportunity to broadcast via broadcasting site. So we offer this at both a Madison and a Milwaukee location. The one in Madison will be at the UW Health American Children's Family Hospital, and the one in Milwaukee will be at the Wisconsin, the main hospital in Children's Hospital of Wisconsin in Milwaukee. And all of that information can be found here under our Baylor event. We also have the Bridging the Gap, which I said if you're interested in, please contact me. As of right now, the transition hub staff are the only people that provide this education, but we'd be happy to come and do a presentation based off of an audience that we mentioned in the presentation. We have a Build Your Bridge family education, and that can be found by visiting one of your local regional center websites and seeing when that training is taking place. We offer that healthcare provider and healthcare professional education. And then, of course, our learning community quarterly broadcasts, where you can find more information about our upcoming learning communities. We typically talk about how and promote our information on our listserv. So by clicking here, you can go ahead and get registered to be part of that list. For 2018, we typically include all of our previous learning communities here, as well as the upcoming dates, which this will be available on our website after this presentation is through. But then any additional information or support materials that are part of that learning community. You can also access past learning communities by going and clicking on each of the accordions to expand that area. We do also offer a list of our regional centers. We are in close partnership with our regional centers, and they are a great support to us throughout the state of Wisconsin. And so I really would encourage anyone who has some time to look and identify where your regional center is and to peruse their website and see if they have any additional information that they could provide to you regarding things that are specific to your area of Wisconsin. We do also have just other areas where we talk about who we are and what we do. And I don't need to go into those too much, but the one thing that I do want to end on is our quality improvement grants. And those have just recently been released, and Colleen is on the call to answer any questions that may pop up as I'm talking about the quality improvement grant. But you can find all of the information regarding quality improvement grants inside of our Health Transition Wisconsin website. Now, the information you'll see here and notice is very focused on the transition focused part of the quality improvement grant because we are the transition website. However, there are a lot of different options for clinics who would be interested in quality improvement work. And we provide that information here. And by going to the grant application, you can see the different areas where you can focus your energy on quality improvement work and how you could partner with Medical Home to create those. One of those focus areas that you can choose and the population you could work with is the adolescents who are transitioning from pediatric to adult healthcare. And we provide some requirements on what we would do as the Health Transition Initiative in working with you to make that possible. There's also a huge component of that that requires family engagement. And typically that's an area that unfortunately is lacking only because, well, because there are a lot of people that would like to be involved, but really it's can I devote the time and, oh, I'm going to be working with all of these professionals. Do I really have something I can offer to this group? And so sometimes with these quality improvement grants, that family engagement part falls off. But really what they've started to do with the medical home grant and the quality improvement grants with here is that they offer that education, that support to really bring family members and family engagement to the table, and how to encourage that type of interaction among your group, and how that family voice is incredibly important as you start to move forward on making those small bits of change to improve your process, your workflow process on something like healthcare transition. Okay, so Colleen, did I get everything? Anything you want to add?
No, that sounds great. Thank you very much for addressing that. And if anyone does have any questions, you can reach out directly to myself. Again, it's Colleen Lane at the Wisconsin Medical Home Initiative, and I'll put my email on the chat box, or as well as Maya. As Maya pointed out, she does have it right here on the transition website. And then we also have similar information on the Medical Home Initiative website. So the deadline is November 16th to have the completed application submitted by. There is also an informational call on October 10th. So as Maya's gone to our website to point this out, you can register for that October 10th informational call. That is from noon until 1 p.m. and we will be answering any questions that anyone has. And so again, we'll go into a little bit more detail of what the requirements are and the logistical information for completing the applications. But this will be the 4th year that we've offered the Shared Plans of Care grant work, and very happy to be partnering with the Youth Health Transition on that focus area that you can select if you'd like to select that area of implementing those strategies to support youth health transition. So thank you.
Thanks, Colleen.
Yeah, you're welcome. Thank you.
And with that, I don't have any additional information that I wanted to share. I know I had reached out to our regional centers and said, hey, do you want to kind of share anything you're doing? I only left you guys about 3 minutes. But Dawn, are you on our call? Oh, okay. Well, I had Dawn, she is part of our Bridging the Gap development team, and she did a presentation for mental health. And what was really unique about that presentation was some of the additional considerations regarding things like disclosure and things that are appropriate to be talking about, and things that you need to be considering if you're going to be going to a different school or like a post-secondary school or college. So it was a very interesting way to collaborate with the regional center on ways to think about things other than the standard things like medicines or it was along the lines of mental health and mental well-being and that sort of consideration with some of the unique parts that come with mental and behavioral health. So I do think it was a success when we had it, and we are working on that one a little bit more, and we would be happy to share that information with any individual who's on who would maybe want to focus on that area. But we're always looking for partnerships and collaborations, and so if you have an idea of a way in which we could be involved in helping to talk about the healthcare transition in a condition-specific or clinic-specific setting, or even just something that's going on locally that you'd like to have somebody from our team available, reach out and let us know. And otherwise, subscribe to our listserv. And again, we'll have that available on our website. And I will notify everyone that we have everything posted and ready to go. And with that, Lynn, do you want to pop up that survey in our chat box? If you have the time, either now or in a little bit, could you please go to our survey and let us know what you think of this presentation? the learning community in general, and whether or not this has kind of addressed some of those questions, interests, piqued some interest, sparked some conversations among your group. And do we have that link? Oh, perfect. All right, the link is up. Everyone can go there, and feel free to let us know what you think. And I appreciate everyone joining us. This concludes this month's learning community. Our next learning community will be November 27th, and I will send out more information on the listserv regarding details and registration for that. Thank you for joining us, and have a great Tuesday. Bye.